Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Welcome back to the Sit and Stay podcast brought to you by RipsyTech. I am one of your hosts, RipsyTech Product Manager Parker Anderson. As always, I am joined by RipsyTech founder and CEO, the quick-witted Tom Tarshis. Hi, Tom.
Hey, Parker, and I think next year, if we're recording on Halloween again, we need to up our game with our some sort of Halloween gear. But I think it's been busy with conferences and weddings and other things, so I think we can give ourselves a break this year.
Yeah, it's been quite a lot going on the last couple of weeks have been nonstop, and I apologize if I sound like I'm under the weather. Probably a symptom of being nonstop for the past 2 weeks and not taking too much of a break. So here we are again for the podcast. Yes, as you mentioned, we're recording on Halloween. Though the episode, I don't think this will be out until the end of November, but. Yeah, next time maybe we'll be donning a witch's hat, and I'll have a broom just kind of on me at all times.
Nice.
So this week's episode, we wanted to talk about this question of having trainees working for your clinic, whether that is a small group, large practice. There is a bit of some implications that come with having trainees working with you. So you brought up this idea, which I thought was a great idea, because the first clinic I ever worked at with you, we did have trainees, and there were a lot of things that did come with that. And maybe I'll let you speak a little bit about what some of those things are.
Yeah, and I think anyone who goes through advanced years of clinical training, there's this progression from classroom work to then seeing a live patient. And then, as you climb the ladder, you're expected to help teach people below you. And it's a very established hierarchy in medicine, but it's also true for psychology and even master's level training programs that you go through this. And I think a lot of people love to be teachers and to mentor and work with younger people, coming to train in the same career. And not universally, but it is romanticized a lot. And I think when I first started a clinic, I wanted to really have an academic feel for the clinic. And so part of doing that is establishing yourself as a training institution where you're going to have people at all stages of training. And we know in mental health, especially, we want to inspire and motivate young people, such as undergraduate college students or recent college students, to enter this field. And the way to do that is by having these opportunities for training within your clinics. And so that's always been near and dear to me. And so then the question comes, though, of I think if you're going to have a place where you're going to do some journal clubs or educational work, or there's no better way than to keep yourself skilled than by having people at different levels of in the training process report to you and ask you tough questions and talk about new findings. And so it creates a nice intellectual and continual learning environment. I think it's really good for the culture as well. But part of this podcast is when you do decide to bring trainees in, how can you do that so it's not extreme hardship on your business and finances, and what are other pros and cons of deciding to engage in having trainees at your clinic?
Yeah, to speak to some of my experience with that, I was not a trainee. I hadn't even gone through my master's program when I was working for you, but it was my first job out of college, and I think because there was such an atmosphere of training and learning, and me myself working very closely with the trainees, we the people who worked at my level developed a very strong familiarity with kind of every step of the process of going to school and then being a trainee, getting your hours, and even before that, like if it's part of a practicum that you're working with this local clinic, and the experience that it provided, even just me, who was not a trainee, but just somebody who was interested in entering the mental health field, was invaluable. I did not choose to enter the mental health field. I chose to go a different route, focusing on research and statistics instead. But when I had applied to my master's program, I'd only applied to one marriage and family therapy program, but I had no doubt in my mind when I had applied for that program that I would get in, and it was a very well regarded program. And when I did my interview, I was incredibly confident. I felt like I knew the correct answer to every question. And in my experience, it was just such an incredibly valuable experience that, I got into that school, but like no doubt in my mind, any school I would have applied to after having that experience, I would have gotten in.
Yeah, and I think there are lots of paths to be a mental health clinician in lots of different schools, and hopefully there are, it's that workforce issue again, that everyone who wants to enter this field, we want to try to get opportunities to recruit people. So,
yeah. So let's talk about what it means for the clinic itself. The benefits of having that like learning environment. And also, as a trainee, you can't take insurance. So I know that there's like usually a flat fee that's associated with seeing a trainee that might be a little bit more cost effective for patients who are trying to receive care from somebody. So, what are some of your thoughts there around how it can benefit the practice as a whole?
Yeah, and let's talk about the finance piece is maybe a good one to talk about first.
Yeah.
And, in general, once you're licensed or have an associate license or training license, you can start seeing patients. However, that does not mean that an insurance company is going to credential you or allow you to bill through their insurance. Now, theoretically, the one exception for this in California is Medicaid or Medi-Cal. Once you have an associate license, you can actually bill and get reimbursed if you're serving the Medi-Cal population. And, theoretically, you could find an insurance company that would allow for billing. I haven't ever been successful in achieving this where, we say, look, they're getting their supervision hours, they're skilled, there are people who can jump in to help, and trying to get the insurance companies to pay even a reduced fee for trainees. But I've never been able to make that happen, although I know that does happen in some places. And for example, at Stanford, where I'm very familiar with, and adjunct faculty, there is still this need to have the attending psychiatrist jump in, even for these fully licensed, potentially eligible doctors to be potentially eligible to be credentialed physicians. They still requires that you have the attending doctor actually be present, lay eyes on the patient, and talk with them themselves. And it creates I think, doing therapy visits or psychiatry visits, it's different than, going to see your primary care doctor or getting ready for anesthesia for surgery, where it sort of feels less intrusive to have a line of trainees sort of following someone else around to learn. It's not really an environment that can feel great to have multiple providers in the room. And even for the times when people have been seeing trainees and I've jumped in to join the session, I try to get the information I need and then jump out as quickly as possible, because you're working hard to build this one-to-one relationship. And I even had a middle school student who was being seen at another Bay Area institution who reported, was doing Zoom visits, and sometimes there'd be 4 or 5 people on the Zoom visit asking her about her anxiety. And, this is a bright, smart kid, and she sort of was like, with, tease or, but even she was like, I don't know who was talking or who was who and what's going on. And that just is not doing the trainee piece correct, but it's something that, they have to have the one person to bill under and then one trainee seeing them. I don't know why there were so many others, but I mean, I'll pause there for a second and then get back to more of sort of the financial piece.
Yeah, well, I suppose you're kind of painting a different picture than the one that I had in my head. So, just to make sure that I have this correct, I understand that there's a trainee who sometimes, is assigned to see a patient, and you're saying that, that trainee does have a supervisor that is typically being billed under the session. And when it comes to, like, when I think of, I'm not a doctor, so, when I think of, like, I don't know, watching Scrubs or something, you see there's always, doctors following somebody around who are, like, medical students or currently learning, but that's, taking place in a hospital, kind of more general patient care or surgical care. And here we're talking about psychiatry. So when it comes to being a mental health provider and being a trainee, is that a typical environment to be in with, other students just for one patient session? Or is it that you really do get to have kind of like your own, like, this is my patient, that, I see them, but, like, sometimes a doctor might pop in. I guess just some clarification there would help.
Yeah, no, good question. And I think in general, most of the training is, the student with their own patient alone for hopefully most of the therapy session, or whether it's a therapy session with some medication evaluation. That's the usual training if you're going to be an outpatient mental health clinician.
Okay.
And then usually it's either, and we'll talk about this, if there's a separate cash fee, a supervisor usually doesn't have to come into the room, but there's always a limit depending on where you're at with your training, with, like, okay, if I have 10 hours of patients, I need 1 hour of supervision for each of those 10 hours. And so when we had trainees at Baca getting their master's degree, it was sort of, we had a group therapy session for 2 hours a week for all the trainees to talk about their cases, and then they would have their individual supervision, and they have to make sure they're doing that to meet their training requirements. But in general, it is more private than that extreme situation that I described. Okay. I think that's a situation where it was a medication visit, so maybe there was a whole bunch of people in their psychiatry training, and they thought, well, let's just throw everyone into this Zoom call, and that is not an ideal thing to do for the patient relationship.
Yeah, I mean, I think once we introduced Zoom as something that might be expected from your care, just video calls in general, we were all still just kind of figuring it out at that time. So hopefully people are not still encountering situations like that. So putting it back onto the financial piece, I want to kind of talk about, like, when you decide to make this decision to be kind of like a training institution, what kinds of decisions do you have to make on the financial front when it comes to, how much do you reimburse them for their time as an employee, or how much do their sessions cost? Does it look like something that's profitable for your business, or is it something that's a bit more of like you have to kind of make this choice of just like morally, like what kind of organization you want to have?
Yeah,
Feel
no,
free to
great
answer, however.
Yeah, good question. And depending on how you do it, it can be something that actually could boost profit some, or at least cover costs for your supervision time or things like that. I think if you're running a cash practice, this is the easiest situation, where if it's a group of psychologists that charges $200 or $250 for a 53-minute session, they could bring on psychology students or pre-doctorate interns, postdoc interns, and have different percentage of the rate. So maybe a student is just $40 an hour, and then a pre-doctoral intern who's 4 years into it is $75 an hour, and then a postdoc, so that's someone who already has their degree and they're just accumulating more patient hours before they can be licensed. Maybe that's $100 an hour, and then the costs associated with that is really the supervision time and administrative time you need to help manage their schedules and provide that supervision. So if if you usually make $250 an hour and you're doing 3 hours of supervision, okay, so that would $750 you're giving up by not seeing patients. But if that's 30 hours at $100 an hour, 3,000, right? You can take your $750, and then you're figuring out what you're paying the trainees that are working for you. And this can go lots of different ways, I will say. So there are some places where you're not required to pay students that come, depending on what year they are in the practice. I think anyone who has their associate license or who has finished the actual degree and is just accumulating hours, that can be between you and them to negotiate a pay rate. But you do want, at that point, it's nice to have something reasonable, and if you can give people benefits. But to your point of morality, there are ways where you could have a lot of trainees and provide not great supervision and not pay them well and bring in a lot of extra money to your practice. That's not the right attitude to go into the process with. And I think for us, it was always, we want it to be the best training experience. And we used to just try to make it so that we could break even on the whole training piece. But then the positive that comes is if they have a great experience while they're finishing their training at your clinic and they want to come work for you as an employee, that immediately is, if you think about a recruitment fee, or if they sign on with you, they're already trained. That's where the big win comes, that if you have a nice environment and people like they're training with you and they stay on, then it's a great experience. I think if you do take insurance, things get much more complicated with having trainees, because in general, like I mentioned, you're not allowed to bill insurance for trainees. So that means either you need to find a way as the licensed clinician to pop into each session to bill under your name, or you need to do a little extra paperwork and documentation around having patients connect with trainees at your clinic. And so, for example, when you sign a contract with an insurer, they will tend to have a stipulation that you're not allowed to have a potential patient see someone who's not credentialed working at your clinic. So if we're in network with Optum and we have someone who's a trainee at our clinic, if there's any opening with anyone who's credentialed with Optum, they have to take that patient. If there are no openings for anyone that takes Optum, from your licensed people, you could offer for them to pay cash and then to see the student, but you have to make sure that you're being careful about documenting. The clinic is very full. The only opportunity we have is with this trainee, and they're, $50 a session or whatever the fee is. So you have to be careful about what your insurance contracts allow is the first piece. And then the second piece is you have to be ready to deal with, wait a minute, my other, I'll use the example of a family with lots of kids. My other kid is seeing this, fully trained physician for our $20 copay, but then you're saying my other kid needs to go see this trainee that costs $75 an hour, and they're not even at the same level of this person. So it creates this dynamic around paying more for a less trained clinician, which again can be managed with there's pros to having someone who's just in their training and can connect better with a lot of patients, know some newer stuff, but it does create some of these logistical issues you have to address when running a clinic.
Yeah, so I mean, how do you respond to that? Because I imagine that is a frequent question that comes up where somebody who maybe it's their child that's receiving care, and the clinic is offering hey, yeah, you can see our trainee. How do you typically go about that conversation to kind of validate that the trainee is still going to provide a level of care, a quality of care that meets what they're looking for?
Yeah, I think you do. We always go back to the they're getting supervision with this trained and licensed clinician. We work hard to have a great educational environment, and there's lots of other people they can get help with. I'll usually point to the research that shows it's not actually your credentials or degree or how long you've been out of training that determines how good you are at therapy. So having the most senior person doesn't necessarily mean that it's going to be the best fit or get the best results. Talk
Right.
about that we monitor how treatment is going, and if there's problems, we will always work to address it, and that people are very supported. So that's kind of the wheelhouse conversation. I think at the clinic, where you started, Parker, for when you have something like an intensive outpatient program, it works very well to assign trainee therapists to the kids because it's something you don't bill for anyway individually. And then, as I think you saw happen often, a lot of the trainees are outstanding or good at connecting with the teens. And then when the teen wants to stay with, hey, you can stay with this person, they're not in insurance, but they're kind of a low-cost provider, then it's very easy for the parents and the kid know them, and it's a nicer path forward.
Yeah, that was always really good for continuity of care, transitioning into outpatient from intensive outpatient, because these trainees generally have more available schedules compared to, a full-time licensed clinician who's working outpatient and sees some IOP patients. They usually might be, making space to see IOP patients, but not necessarily have the space with their outpatients to add another patient to their caseload. So that makes a lot of sense. Something that I kind of wanted to touch on was this process of, say you have an outpatient clinic or just really any clinic, and you decide, hey, I want to bring on some trainees. Then what? Do you have to file any kind of extra paperwork, like on a legal front? Do you have to, what are the things that you have to do to find those trainees? So, sometimes it might look like going to, like some kind of recruitment event at a local school or something like that. So, yeah, what are your thoughts there?
Yeah, good question. And it's nice to build relationships with different schools that are going to send trainees to you. And there are some students who at certain schools where they're sort of in charge of finding their placements, and they might reach out to you. And there's always some paperwork that you need to do for the institution they're coming from. And then, so lots of times it's better to just get your clinic affiliated with some nearby, you know, psychology schools or social work, or if you're affiliated with the psychiatry program, there will definitely be some sort of relationship and signed agreement between the entities, and especially sort of about what they expect you to provide for their students. And that's the most important piece. You do need to then make sure that your malpractice insurance is active for the students, and it's actually they'll all have malpractice from their training program, so it is really like almost nothing, maybe $40 a year or something to add the students to your malpractice insurance, because it's very low. It's just a very low risk of anything bad happening. And then it's that decision about, okay, are you gonna, are they at the level where you can offer a stipend or not? Are they at the level where they can actually, be regular employees and have benefits? So then that's sort of up to your business. Like, if you meet the school requirements, then it's looking into what you want to do about giving some sort of stipend or benefits or salary to the students.
So yeah, how about like the kind of, I guess, marketing piece of that? Like, how do you get yourself noticed as a potential option?
Yeah, in general, if you go out to different schools, and there are events at each school, like Santa Clara University would have like an open house for placements, and you could go there with a table and talk about the experience. So there are direct ways to, if you want to get students from a specific school, to reach out and say you're offering training, and a lot of them have these tabling events that you can go to and present, and that's how we got a lot of students from different programs. But I think it goes to, interestingly, when you just post for jobs at your clinic, you do tend to get a lot of people who are not fully licensed and credentialed applying for those jobs. So, and then you have to look and see, they're actually just have their associate license. And we even when it clearly says on the web page, you need to be fully licensed and credentialed in California, you still do get a lot of people looking for hours who will apply for your positions.
Gotcha. So it's kind of like, yeah, these people might have already contacted you. You just need to kind of go look for them in the right spot. Sometimes it sounds like. Interesting. So before we wrap up, I'm kind of looking at the rest of our questions. I think we've answered quite a few of these. Is there anything that's coming up for you that you think we should make sure we cover before we move on?
Yeah, no, I mean, I think it's, if you're a smaller practice and you're taking one person that you're going to do the individual supervision for, that's pretty straightforward. If you want to really and there are some clinics like this where there's maybe 2 supervisors, and then they take 10 students, and that's their business model. And then they offer like some extra supervision and educational experiences. I think is depending on where you want to go with bringing trainees in, you can kind of decide what sort of curriculum and program you'll put together. And yeah, if it's something you're passionate about, there are nice ways to make it work, for your business as well.
Well said. Well said. All right, Tom. Do we have a mental health business moment this week?
Did I talk about updating our address and being kicked off an insurance company?
You did mention that, which was a pretty eye-opening, wow, I can't believe that happened. Do you have a follow-up on that?
Well, so yeah, it's good, right? Because we tried to update an address in this centralized database. One insurer thought it meant that one of our clinicians was no longer working for us. So they said, we saw they're not working. We've canceled them. State of panic, sort of reached out, and then received a letter back from the insurance company that everything was fixed. But then, of course, last week, a bunch of claims started getting denied for this provider from the insurance. So when the billing person called about the claims, they pointed out, no, the patient has that provider is not with you anymore. So then it's this hassle of, well, here's the email saying they're reactive, reaching out to everyone again. The person who had told us everything was fine acknowledged, actually they see that things weren't fine everywhere and we're trying to fix it again. So, it's just, I know it will get resolved, and I do feel like we will get the payment and things will get corrected, but it's just very frustrating with the time lost to cleaning up some of these administrative burdens.
Yeah, understandable, especially when it's something that for you was trying to make things, streamline things a little bit, make things a bit more efficient, and then it just ends up, hopefully causing a temporary burden. That's the cost of efficiency, I guess. Hopefully long term will just pay off.
Yeah.
All right. Well, pretty good moment. If good is the right word. Great example, I will say. So there you have it. Thank you for joining us on this week's episode of the Sit and Stay podcast, brought to you by RipsyTech. If you have questions you'd like to submit to our audience Q&A or are interested in featuring as a guest on the show, send us an email at sitandstay@ripsytech.com. All right, Tom.
Thanks, Parker. See you soon.
Bye.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at RipsyTech.com.